Hi, I'm Rhonda with Prime Performance Nutrition. I've got Dr. Austin Doby here at the booth. Hey, Austin, thanks for stopping by.
Thanks for having me. How are you today?
Good. Welcome to Vegas.
Thanks. It's a fun place to be.
Yeah, but you're here for just a short time.
Yes.
Good. So today, I want to talk to you about the big EHV-1 that's going on, and let's try to educate and give our viewers some insight of what you're recommending on the track, as well as your client horses and your own personal horses.
Yeah, for sure. You know, I think that overall as a horse community, we've done a really good job being aware and transparent of where these cases have been and locating and tracing and back tracing and figuring out exposures. We've done that really well. For population health as a whole, I think vaccinating is the first thing you have to talk about. You know, there's a effective vaccine for regular EHV-1. It's not 100% effective against the neurologic form, the EHM, but it does have some cross protection that helps a little bit.
So the antibodies, some of the antibodies will cross over.
A few, yeah. So it's better. It's the best we've got. It's better than nothing, right?
Right.
With that vaccine is given biannually every 6 months. That is a little different based on the population of horses you're working on. You know, at the track, it's every 60 days. We keep it because it's such an economic loss there if you get the respiratory form for the whole track. But in the general population, it's biannually, so it's pretty easy to do and stay on top of.
So real quick, on those race horses, every 60 days, is that not over vaccinating?
The thought is just to keep the antibodies at a certain level.
Okay.
And they've done a bunch of research that like exposure at this point is just trying to keep them up here at a higher protection for those horses because it is such a population-based type environment.
Good deal. That's good to know. Okay, so on the track, you're vaccinating every 60 days. What are they doing, and what are you recommending for all of us going up and down the road as far as the biohazard side of it?
So that's the second thing I think you have to talk about. You know, you do the vaccines, that's easy, you take care of that. The next thing you have to think about is just biologics and biohazards. So I tell my clients, anytime you travel, you need to treat every stall like it's been infected because you don't know what horse has been there. Most of the time, it's probably going to be clean. But I recommend ag washing with that symbiont that was formulated at Colorado State. Do that before you put the horses in there. We don't share. I tell them not to share water hoses. Like if you go down the shed row and the water hose goes in every horse's bucket, well, you just went through there and touched
exposed the whole barn.
Right. So we try to really just recommend clients use what they take with them to the show. You know, pitchforks, manure buckets, all those things. Just kind of keep it isolated to yourself. You know,
and don't go two stall rows over to pet somebody else's horse.
Right. I mean, we're all like horses. That's why we're here, right?
Right.
So naturally, we want to talk and communicate and go see people. But I think it is good, especially during times of outbreak when there's something currently going on. Just try to like stay to yourself as much as you can. I know in the warm-up pen, we all want to talk to our friends when we're warming up or when you're standing there waiting for your turn. We all lived through a pandemic 5 years ago, right?
Right.
The social distancing, it's the same principles as that we all went through with there. And it's just applying it to our horses now.
Got it. Okay, so we've discussed the biosecurity, the vaccines, and all of that. Now, what can our audience do other than the vaccines to boost their immune system even more? I mean, suggestions?
Yeah. So it's the same with people and horses or any animal. Your immune system starts with your nutrition, right?
Right.
So you have to have enough protein to make antibodies for everything to work properly. You've got to have vitamins. You've got to have minerals, all those things. So when people are concerned about neurologic conditions like the EHM that we're seeing currently.
Correct.
You know, the biggest thing to combat any type of neurologic condition in a horse is increasing your vitamin E. You want to typically around 20 international units per kilogram. If you math that out, it's roughly 10,000 units for a 1,000-pound horse a day. So with that being said, you make two great products. You have the Prime Defense that's got other vitamins in it, as well as the vitamin E to help boost the overall immune system. And then your other one is Prime 4000 that has 4,000 IU or international units for the vitamin E. The thing you have to be careful about when you're looking at vitamin E is not all vitamin E is equal. There's some that's like Coke versus Diet Coke, okay?
Correct.
But when you're picking out a vitamin E supplement to support these things, you really need to read the label and make sure that is the one that's in there.
So to recap, we're talking Prime 4000, 2 scoops a day, which would be equivalent to
That gets you right to 8,000, right?
to 8,000
Yeah.
IUs.
Yeah.
And then in the Prime Defense, we have another 2,000 IUs.
Mm-hmm.
So that gives them their 10,000 international units
Right.
that they should be getting
Each day.
each day.
Yeah.
Anything else that you would do?
I mean, I think that covers the most of it from a nutritional standpoint. Is just making sure you have, great quality for just going to have all the protein in it.
Mm-hmm.
These horses that are in stalls, they're not out on pasture. They're not getting vitamin E there. So vitamin E is crucial to them. So making sure you get that number there. And then I think that's the best holistic approach there is.
Cool. Well, Austin, thanks so much for taking your time out
Yep.
at the NFR from having fun to come over and sit with me at the booth today. You have fun the rest of your days here, and we'll see you down the road.
Of course, anytime. It's my pleasure. Thank you.